audience Q&A toward the end of the program after our panel discussion. So I encourage you guys to be thinking about questions you may want to ask. Now, it is my honor to welcome someone who has been a steadfast advocate for equity, access, and community-centered solutions across Harris County, Commissioner Rodney Ellis.
Thank you, Brittany. Brittany does a great job, and I'm just so proud to have on our team. Give her and the entire team a warm round of applause. It was their idea to start this last Tuesday. We've been moving, it's been such a busy month, the last Tuesday series, and I'm just amazed that they put a lot of thought into figuring out issues that are important and that are relevant. And they just do this up with such style, don't they? I came in, I went by, walked around the trail, and I saw these chairs wrapped up in plastic, and I said, no, we have an event today. I wonder what these chairs wrapped up in plastic. So they took them to somebody's house, but they really look good. It's really first class. We're here to talk about one of the most urgent issues facing our community. Harris County is the most dangerous place in the country for a black woman giving birth. That's simply unacceptable, and we have to change it. The risk of pregnancy and childbirth are not shared equally. In Harris County, black mothers are dying at nearly double the national rate, and more than 4 times the rate of white mothers. Most of these deaths are preventable. Let's be clear about what's driving this. Racism is a public health crisis in America today. It shows up in who lives and who dies. This is happening in a place with world-class medical resources within walking or at least biking distance from where you are right now. It's about access to care and the type of care a black woman receives when she walks through the door. Bias in our system still shapes who gets heard, who gets believed, and who gets treated in time. So a little bit about what the county is doing. Our health director here, Leah Barton, give a warm round of applause from Harris County. Harris County is working to expand access to care and meet families where they are. In 2022, we launched a maternal and child health care program with $7.7 million in federal ARPA funds. We were fortunate and we're so appreciative to the Biden-Harris administration for giving us a record amount of money and giving us the latitude to decide how we would spend that money. From that money we set aside for that maternal child health care program, today nearly 500 mothers have enrolled, receiving support through home visits and care coordination. As much as I'd like to take credit for pushing that program, the truth of the matter is Leah's predecessor, Barbie, when she was here, came to meet with me one day, and I was trying to remember I don't remember the statistics, but I remember the analogy. She said to me that if Harris County, which is Houston, Cook County, which is Chicago, and if Wayne County, which is Detroit, lowered their black infant mortality rates by some number, and when I went upstairs, I was trying to plug in the AI to find it, but I even used that at a couple of national panels. But if those 3 cities would lower their rate, could get it lower enough to where it is for white women or other women in those 3 jurisdictions, it would put black women on par with other women nationally. Now, Leah and I were debating how could that number be right. Then Stephen Williams, who's with us now. Stephen was the health director at the city of Houston. Give him a warm round of applause. He's with us over our programs here at Harris County now. We were just playing with the math, trying to see how would that work. Well, you know, Harris County is 5 million people. Cook County is a little more, 5.2. I don't know, Wayne, Detroit, 2.5, 3 million people. I mean, that's a lot of folks, but it's a big jump to get that number down. In Harris County, we also expanded access to reproductive health care with an additional $6 million in ARPA funds after Roe versus Wade was overturned. Give our friends from Planned Parenthood a warm round of applause. We did as much as we could while we could. The process for next year's county budget is underway, and it is challenging, as are budgets with all local government units throughout Texas. And I'm going to work to preserve this program because of its life-saving opportunities. But I need you to raise the issue to fight alongside me. We're going to have to make cuts. And the reality is, who shows up and who does not show up, who has access to power and who does not have access to power, will determine where we make those cuts. That means showing up, it means speaking out, it means demanding a county budget that reflects our values and priorities. And I'm embarrassed by that statistic. The bigger picture for tonight's event, the bigger picture is stable housing, steady income, access to food and transportation, and safe neighborhoods all determine whether families can be healthy. That's a tall order. That's the big picture. So we can hone in on those micro issues, but that's the big picture. Addressing this crisis means improving care and foundational and basic needs. Tonight you hear what families are experiencing, where the gaps are, and what's making a difference. I encourage you to ask questions, make connections, and leave with resources. In closing, Black mothers deserve more than just survival. They deserve to be safe and to be supported. They deserve to raise their families in healthy, stable communities. That is the standard, and that's the work ahead. I appreciate you being here, and as the son of a powerful Black woman from Sunnyside, and the husband of a powerful Black woman who went to Howard University, and as the father of 3 girls that I expect to have the money and the sensitivity to take care of me when I can no longer take care of myself. I want you to know that I know women matter. Thank you and welcome.
Thank you so much for those words, Commissioner. Before we move to our panel tonight, I'd like to take a moment to highlight the Call Me Mother installation featured here this evening. We are honored to have one of the artists behind this work with us. Please join me in welcoming Stacey Allen to share a brief overview of the project.
Hello and good evening. It is such an honor to be here with you all. Thank you to Commissioner Rodney Ellis for opening up the space for this wonderful event, Beyond the Womb. So I just want to speak a little bit about the highlights of this work. I am Stacey Allen, and I am the founder and artistic director of Nia's Daughters Movement Collective, and we're a professional dance company based in Houston, and all of our work is to tell the stories of Black women and girls. So when Deborah Deep Mouton contacted us to be a part of such an important project, we made sure that we were able to join. I am also the mother of 3 beautiful children who I birthed all here in Harris County. So these statistics hit home personally because I did have challenges with each of my births. And so I'm so thankful that Precinct 1 has taken on this incredible mission to correct some of these challenges that we have faced due to systemic racism. While we are at this beautiful event, we cannot forget that Black women, Black mothers in particular, are in a state of crisis. As we've already heard these staggering statistics, I want to highlight the work of the Call Me Mother experience. What our goal is to put real stories to these staggering numbers. So what we're gonna do is tell the stories of Black mothers through art, made in community activations, and all of the artists are affected by the Black maternal health crisis. All of us have each had our own maternal health issues, and we are using art as a gateway to amplify these issues and imagine possible solutions together. As mentioned earlier, I am the mother of 3 children, and I am just so grateful to have an opportunity to share my story through the art, through the Call Me Mother experience. We are currently, did y'all get a chance to see it in Norway? Okay. We are currently working on an exhibit that will open up this October at the Health Museum. which, thank you, which is particularly exciting because we know that the Health Museum is a Smithsonian affiliate. And in addition to this exhibition, in order to reach the most affected population, we will have satellite art pop-ups that will extend that experience. The experience that you can get in the museum will be extended to satellite sites throughout the greater Houston area, specifically in predominantly Black neighborhoods, so that those who cannot make it to the museum will still have access to this important work. While Houston may be leading in maternal danger, it also means that we are perfectly positioned to offer inventive and creative solutions for Black families, Black mothers, and our greater community to turn the tide on maternal health. And I'm forever grateful for Deborah D. Mouton for leading this initiative. We are still looking for sponsors and partners to bring this vision to life, and you can find out more about the Call Me Mother Experience on IG, Instagram at Call Me Mother Experience, or also visiting our website at www.callmemotherexperience.com. Again, thank you so much for coming out, and I hope we're able to connect with you in the fall when the exhibition opens. Thank you.
I'd like to now introduce you all to Lariana Vernado, who will serve as our moderator for tonight's conversation. Lariana is the Maternal and Child Health Maternal Program Manager at Harris County Public Health and a doctoral candidate at the University of Texas Health Science Center School of Public Health. She brings a strong background in maternal and child health across research, service, and program leadership. Prior to returning to Houston, she served as the Maternal and Child Health Program Manager with Unity Healthcare, the largest federally qualified health center in Washington, D.C. Lariana's work began with research focused on chronic disease trends amongst pregnant women in Houston, which led to a published study. She has continued her commitment to public health through her service in AmeriCorps and a maternal and child health fellowship. She holds a master's of public health in epidemiology with highest honors and is the founding member of the Black Excellence in Public Health, an organization dedicated to amplifying Black voices in the field. She currently serves on the City Match Board and is one of its youngest one of its youngest board members, We are honored to have her guiding tonight's conversation. Please join me in welcoming Lariana Vernado.
Good evening, everyone. So I'd like to welcome some of our panelists this evening. We have three panelists. We have Raina Reed Rafford. Raina Reed Rafford is a Houston-based journalist, advocate, and founder of Pregnant and Black Incorporated, an organization dedicated to improving outcomes for Black mothers and families. She has built her career as a reporter telling community-centered stories, with her work appearing in outlets like Essence and other local and national platforms. Her reporting has consistently focused on equity, public health, and the lived realities of Black communities. Motivated by her own experience navigating pregnancy and care, Raina launched Pregnant and Black to create a space where Black women can access culturally relevant support, resources, and information. She brings a unique perspective that bridges journalism and advocacy, using storytelling not just to inform, but to push for systematic change and ensure that the voices of Black mothers are centered in conversations about maternal health. Please welcome Raina Reed Rafford. Our second panelist, Dr. Faith Ohuba. Dr. Faith Ohuba is a board-certified OBGYN, speaker, and maternal health advocate based in Houston. She completed her medical training at Baylor College of Medicine and has built a career focused on women's health with particular attention to the disparities impacting Black women. In addition to her clinical work, Dr. Ohuba is a recognized media contributor and public educator, frequently appearing on platforms such as CNN, ABC News, and NBC News to discuss maternal health, reproductive care, and broader health equity issues. She uses her platform to translate medical expertise into accessible information, helping patients and the public better understand their care. Her work sits at the intersection of medicine, advocacy, and communication, focused on improving outcomes, increasing trust in care systems, and ensuring that Black women receive the quality, dignity, and support they deserve throughout pregnancy and beyond. Please welcome Dr. Faith Ohuba. And our third panelist, Dana Harper. Dana Harper, RN BSN, is a labor and delivery nurse with over 7 years of experience caring for women and families throughout pregnancy, birth, and the postpartum period. She earned her Bachelor of Science in Nursing from Prairie View A&M University, a proud HBCU, and is currently pursuing her psychiatric mental health nurse practitioner degree at the University of Texas at Arlington, with plans to specialize in women's mental health, including postpartum depression and anxiety. In March 2024, she founded Harper's Helping Hand, a doula agency to advocate for and protect women, especially Black and minority mothers, during one of life's most vulnerable seasons. She is deeply committed to advancing Black maternal health, reducing Black maternal mortality, bias, and improving overall quality, safety, and equity in maternal health. Please welcome Dana Harper. And I will join them. So first, I think it's important, first of all, thank you, Commissioner, your entire team, for providing such a safe space for us to have these conversations. And it's so important, especially sitting in this county where we have some of the worst health outcomes. But it's people like us that are in this room that create spaces for us to have these conversations and to join one another so that we can find an equitable solution for all. So thank you. And with that being said, as we kind of navigate through providing safe spaces, especially for Black women, to discuss maternal health, it's only right that I give the honor to Raina to share her story and what made you take that leap from not being heard into advocacy, and what was your overall response from people when you turned to advocacy?
When I was 30 weeks pregnant, I was in so much pain. I went to the ER with my husband, and the doctors in the ER at that point told me I was dehydrated. They said, "You're fine, pregnancy is just painful." So went back home, tried to drink lots and lots of water, even though I had already said I drink a gallon of water a day. How is it possible for me to be dehydrated? So then a week later, I ended up back in the ER. This time I was literally wheeled in screaming. And the doctors on staff were still trying to say that I was simply dehydrated and that I could be discharged. But this time around, it was the day before my baby shower, and my family was in town. And I happened to have 5 doctors in my family. So I had 5 doctors that were in the waiting room that day that refused to let me be discharged. And because of their advocacy, I was able to receive an MRI. And when the results of that MRI came up, they found out I had acute necrotizing appendicitis, and I was rushed into surgery immediately. If I had been sent home that day, me and my baby most likely would not have made it, and I would have been another statistic. And so Fortunately, the surgery went well, and my daughter is a lovely, thriving 21-month-old now. But one night I was pumping for all of those exclusive pumpers out there, you know, that 2 a.m. pump. And I just kept on thinking, you know, I am here because I happen to have 5 doctors in the waiting room, but I know so many other women don't have that, especially Black women. But what if you could in your pocket? And so that's literally when Pregnant in Black was birthed, and I started the idea for the app, and it is now available in the Apple Store, soon to be coming on Google Play. But you can download the Pregnant in Black app, and through that, you will be connected with an advocate, someone with a clinical background who can provide that real-time advocacy for you in the moment, because I truly believe that no person should feel alone during such a vulnerable time, and we should have access to that kind of advocacy and support.
Absolutely. Yes. And thank you so much for sharing your story. I think I'd be remiss if I didn't acknowledge that there's so many stories that are unshared, untold. And we know through the media what's currently happening. And we acknowledge that as we're sitting on this panel, and then we have the audience here supporting us. And I guess this question is for Dr. Uhubu. How do we rebuild trust between Black mothers and healthcare institutions? Just with this situation, if she had not advocated for herself or had others advocating for her, but there's so much mistrust, especially in healthcare institutions. And so based on your experience and just your knowledge, how can we rebuild that trust?
That's a little. Can you guys hear me? You can hear me?
No.
How about now? Yes. Awesome. Good evening. That's a loaded question, but I think I have some ideas, okay? Unfortunately, some of what Black mothers have to do is really research who their care team will be. So unfortunately, you have to take some of that responsibility in your own hands at times. And I've had patients literally come to me just to interview me before selecting me to be their physician. So that is something that I don't know if all patients know they can do, instead of being assigned, oh, I just have to, or you can actually do your research, make an appointment, interview, select, or get a second opinion. So that's one thing. The other thing is, I don't know if patients understand there is an escalation system in place at hospital systems, meaning if there's a situation with your nurse, even your physician at times, you can escalate and ask for somebody. You know how we do that in real time at McDonald's or wherever. You can somewhat have it your way, but not all the time. But you can feel empowered to go above until you are able to communicate with somebody that you do feel that you can trust or have rapport with. So some of it is also a little bit of legwork on the patient's side.
And you talk about choosing your care team and things of that sort. And for Dana, who works as a doula and midwife, we hear that so many Black women are turning to doulas and midwives. In your expertise and opinion, why do you think so? And how important is it that we have such strong care teams? There's a time and a place for OBGYNs, there's a time and a place for midwives and doulas, and everyone understanding what their role is on the care team. But why do you think that Black women are turning to doulas and midwives?
Okay, so much like Raina said, fortunately she had 5 doctors in her family. A lot of women and a lot of people, we don't. So I believe that women are turning to doulas so that they have that continuation of care throughout their pregnancy. You need that support. You need someone that can advocate on your behalf, that don't have to focus on a lot of other patients at that time. You have their sole focus and they can focus on you. Advocate for you, educate you, even speak up for you when you're in pain or you can't at that time. So I do feel like they are turning to doulas and other things, even sometimes outside of the hospital, more so because they feel safe and they feel like someone is with them throughout. I recently heard someone refer to pregnancy as a marathon, and it is. It starts before you're pregnant. So having someone with you before you go to the hospital, while you're at the hospital, and even postpartum. Sometimes we forget about postpartum, but that's very important.
Yes.
Preeclampsia is a huge condition that oftentimes can be missed and actually a huge contributor of maternal death and mortality in Texas. So preeclampsia is basically hypertension in pregnancy. I had it postpartum actually, and didn't realize it, right? And I'm an OB-GYN. So the symptoms can be, swelling, high blood pressure, headaches, nausea, vision changes. The CDC has a whole campaign, Hear Her, right? So not just identifying those symptoms, but making sure you get heard and escalating and having other people in your room advocate for you, because it's not in your head. It's definitely not in your head. And but I would definitely say those are some of the warning signs that you have to be very mindful of.
And then also talking about those warning signs, it's very important that we acknowledge maternal mental health during pregnancy, postpartum. We always talk about it takes a village to raise a child, and how everyone in that household matters. And in our program at Harris County Public Health, we make sure that each person is afforded the opportunity to express themselves in the household. We make sure that we acknowledge fathers and partners and include them in the care, including them and their voices to be heard. And so when we talk about maternal mental health, for Dana, what roles do you think that stress and day-to-day life play in maternal health outcomes?
Stress in everyday life can affect us, right? So imagine being pregnant. Stress in pregnancy can increase your blood pressure. Sometimes it can cause you to go into preterm labor. So all of these things are important. So having, like you said, if you have a partner, making sure that partner is there, having your doula, having your support person, making sure that if it's stressing you out, remove it. Try not to focus on that, which is easy to say, but you have to try, especially while you're pregnant. So I do think that that's important. Stress can, like I said, cause those different types of things. So walking, working out, trying to stay in a positive mindset. Breathing is so important, although it may seem like a slight pause that we do. Taking that nice deep breath can help to reset your whole mental shift.
Yes, absolutely. And when we talk about just mental shift and everything that comes with pregnancy, I think I want to follow up with Dr. Owubu. Why do you think outcomes are so bad for Black women in Harris County when we have one of the largest medical centers in the country? Yeah.
The problem is multifactorial, right? So the solution is going to be multi-layered, right? So you can't ignore systemic bias and racism, right? Which is why we have programs such as implicit bias, right? Training in hospitals and medical education. You can't ignore, policies that block access to care, right? Whether you're in pregnancy or even postpartum, right? And the postpartum trimester is sometimes a gray space in an area where a lot of things can happen, right? And not just that, there's sometimes a missed opportunity to plug women into primary care, right? So we find out that you have, for example, preeclampsia. Okay, we know that, but you do have a higher chance of having hypertension outside of pregnancy, right? And if that's not treated or caught or followed up on in your postpartum period and again connected to a primary care, you're a walking risk factor for this to happen again, if that makes sense. So there's and then, Harris County is a large medical center, right? And so you're gonna have a lot of high-risk cases here as well. So you have to also, and we're also is a large teaching center as well. I can go on and on and on, but the reality is the systemic issues, policy issues, and lack of access to care.
Absolutely. And I think that we all agree that it's time to stop working in silos. Healthcare systems, educational systems, It's time for us to get, what we pride ourselves in at Harris County Public Health is getting into the schools. The public health schools, the medical schools, the teachings, and things of that sort, because I know that prior to the MPH becoming a reality in, public health, a lot of doctors did not understand public health. They understood how to treat a patient, but they didn't understand how to treat a population. And so now that we know the issue, we're working towards that. It's so important that we don't work in silos. It's so important that we put funding into maternal health spaces, and not only in the larger institutions. We're talking the grassroots organizations. I think one of our biggest lessons learned and beauty of the program that we have at Harris County Public Health is that we leaned on the community for answers. When you start to include the community in those questions and those solutions, they feel a part of it and they're more likely to respond. And so that brings me to just cultural awareness for Raina. As you've been talking to women of varying backgrounds, what is the common theme that you continue to hear?
Some women are scared to speak up because you feel like you're in this position of authority. And one of the pieces of advice I always like to give is, you are the star of the show. When you are in front of your doctor, make sure you have your list of questions, because sometimes I forget things. And especially when you're pregnant, it's just completely out of the brain. So I came into every appointment with my list of questions, and then I think having the people in your life that are also with you being aware of what can happen is also very key, because I loved my OB. I had a doula. I had what I thought was my pregnancy dream team, and then I ended up in a random ER where no one knew me. And so that's one of the things I'm also really proud that Pregnant in Black has a profile for your care companion, because I didn't like that pregnancy felt like a group project that I was doing all of the work for. Didn't like that in high school or college. It definitely didn't like it when I was pregnant. So it's really important for everyone in your life to be educated. And as everyone on this panel has mentioned, pregnancy doesn't start just when you find out you're pregnant. That education needs to happen pre-conception, during, and after you give birth, because that's when also woman is so vulnerable. You're going to all these appointments for your baby, but I was like, well, what's going on with me? I was asking the pediatrician, like, what's happening? Why is my hair falling out? What can I do? I'm freaking out. And it's just important you have to speak up. And then if you are in a position where you are unable to do so, make sure that the people in your life know this is your time. We need to make sure that everyone knows that we are the stars of this show.
Absolutely. And before we actually open it up to Q&A, I want to give everyone the opportunity to speak on a question I have. If every Black woman in Harris County could hear one message from you today, and I know that we discussed this before, we have so many ideas, we have so many thoughts, and we wear so many hats, just as a panel. What would you want that Black woman to know? And I'll start with Raina.
Pregnancy isn't something that we do alone, and you should never feel alone in your pregnancy. So make sure that you are doing what you can to surround yourself, whether that be virtually, in person, but you're interviewing the people that you are going to be working with, and you can I know I talked with Elaine Welteroth once, and she said she fired her birth team like a month before she was supposed to give birth to her first son. So get it until it feels right.
I agree. I always say fire and hire as much as you desire. And I'm sorry, Dr. Brown, you're in the audience, yes. So I'm sorry, my boss is in the audience, but she approves my message. And my executive director is in the audience too, so. But yes, absolutely, until you are heard. And I think that we share the same sentiments, that you have to be heard. It takes a village. It takes a strong care team to be in such a sacred space where you're bringing, life into this world. And so, Dr. Ubu.
I agree with what everybody has said, but I don't think patients really understand how powerful their voice is. Like, I really don't think they do. We hear the aftermath in terms of stories, like this happened to me, and then this happened, and then this happened, but in the actual moment of something not going right, your voice is incredibly powerful. Whether that voice is saying stop, guess what your care team has to do? Stop. Okay, right? Now, I'm not saying to like use it, unnecessarily or things like that, but in general, part of what I've seen in clinical practice has been also the fear of using your voice. I had a patient actually say, I know, Dr. Huba, you sent me here for preeclampsia evaluation. My labs didn't get done on time. I'm like, okay, this is a problem. But she didn't want to complain. I didn't know because I'm in the clinic and she's in the hospital. She didn't want to complain. We delivered her baby and she said, but I don't want anybody to hurt my baby. I don't want to complain and then somebody do something to my baby. So that really shifted. That was a moment of shifting how I think about advocacy, because you're a mom, you want to protect your child, but at the same time, use your voice with strategy is what I would say.
Thank you. Dana?
Well, honestly, all of those are correct, and I agree. I would say the same, fire and hire as you please. Your voice matters. To piggyback off of what Doctor said, saying stop. Tell them no. Have someone advocate for you if you don't feel like it. Oftentimes I feel pregnant women, they don't want to seem difficult, or to echo what she said, they don't want things to happen to their child on their behalf. Similar to when we go to a restaurant, some people don't want to send their food back because you're like, oh, I don't want them to do anything to my food when I get it back. But this is your body, your choice, your body, your health, your body, your baby. So I would say use your voice. And as we said, hire and fire as you please.
Absolutely. And I think the message that I would give to Black women is own your story. Own it. Tell it. There's so many women that suffer in silence because they don't feel like they have a voice. But then also reach out to community. Don't be afraid to share spaces with like-minded individuals. I think, there's a lot of spaces, there's a lot of community organizations doing a lot of good work. A lot of resources out there, but we kind of shy away from it a little bit. And so I think that I would advise Black women to, like I said, own their story. And that's so important. But before we open it up to Q&A,
Can I say something?
You sure can.
I have a MPH, public health degree as well, but I don't think people understand storytelling is a public health skill and tool. So never feel, like you said, like own your story because it is making a change, because it literally is a public health tool anyways.
And I know we briefly talked a little bit just about advocacy, and it might take some taking it to the streets for Black women. I know you were gonna laugh about it, you didn't mention it, so I mentioned it for you. It's okay. What we find is, especially in public health, and just based on our experiences in the past, that sometimes it takes some radical doings to get things done. And this is one where we are not in the fight alone. Our voices are being heard. The media is putting it out there. Yes, it's such a negative media subject, but it's so important for us to keep telling these stories, to keep providing these safe spaces, such as today. And so I want to thank all of you in a round of applause deeply for joining us today. And now I think we have an opportunity for Q&A. If we have any questions in the audience for anyone.
Thank you so much for sharing your insight. I am Adriana Davis, and I'm the founder and executive director of the Harmony Grace Foundation. And my question is that we often hear powerful stories, and Raina, I heard your story when I attended your event, and hearing it again, it just brings me chills. But my question is, what tends to be the gap between our stories when it comes to actual policy change and practice? What do you think the gaps are?
I think sometimes people can try to disconnect a story from an actual statistic. Like, oh, this happened to this person, but maybe that's a one-off. Or this happened to that person. And I think it's really important to also combine storytelling with data. And so when you are able to merge it, this is a multifactorial issue, as was mentioned. And so we need to attack it from those very multi-factored prongs. So we need to be going at it from the storytelling angle. We need to also be going at it from the statistics angle, and then use those to create policies that can then create change. Right now, there's a lot of issue about whether we can talk about the word Black when it comes to Black maternal health. And I think that we cannot remove it because the evidence is there. Black women are dying at more than 3 times the rate. We know that more than 80% of pregnancy-related deaths are preventable. There is a huge gap that can be filled, so we need to be taking those stories. For every pregnancy death, there are 70 near misses like my own. So we all need to be telling our story so everyone can realize, how common this is. The US is one of the most dangerous developed nations to give birth in. Why? Why are we all risking our lives during every single pregnancy? And so when people can really begin to understand that,
Okay, I will. I'm getting pressured by both sides. So I have a concern. I'm gonna be very transparent, guys. I have a concern that we talk about stories. There's power in that, right? That is truly a public health technique. You need statistics to back science, right, and intervention. But I'm also worried that culture is becoming numb to the stories and the statistics. That's really my concern. And the people or agents or whatever you want to call it that actually could potentially move the needle in a real sustainable way may need to see more, right? So I was in the back room talking to the ladies, and I can be a little bit radical at times, but I do believe that there needs to be like a maternal health march, like a significant, huge, okay, there we go, march, right? So if you think about, I'm not, the civil rights movement, other movements that left marks on society, right? Sometimes there were huge marches, consistent, to get attention, to say we're serious about this. People are dying. And it's not funny. It's not funny that a woman, finds out they're pregnant and then is crying at my office because they think they may die. Like, that makes no sense. So that's what that came from. And if you think about some of the other marches. I don't, you guys can tell me, I haven't heard of a huge maternal health march anywhere.
I'm glad and I'm sad because this is happening now. But I'm concerned about the training of physicians. My grandson is a newly trained physician. One of the things I talked to him about being aware of culture and not isolating people and not understanding. Because when I was working in banking, every time we went to another country, we had to know something about the culture. It's like our culture is being dismissed. Yes, we can march. But if the doctors are not trained beyond the medical, the scientific side of that, if the doctors don't, when they encounter emotions, and I'm very emotional about this because I had an unsettling encounter when I was in treatment for something else, because I felt like the doctor wasn't dealing with me emotionally. not that I expected a psychiatrist, but I think this whole birth thing, you can't help but be emotional. But it does not seem that physicians are getting enough interaction with talking about culture, emotions, not just physical well-being, but mental well-being, and being able to relate to their patients. What can be done about that?
Can I answer? Okay, so I'm actually, and these opinions are mine, okay? So I'm in academics now, so I'm at the University of Houston, so I'm teaching students. I've been in private practice for quite some time. And there are courses, there are, that you're concerned about teaching cultural awareness, so, and that's what I want to get to. So a lot of curriculums do include cultural awareness and training, right? But the point I'm trying to get to is actually threefold, if I can't remember. To me, it's beyond just the color of your skin, but also empathy, right? So when I became a physician, we took the Hippocratic Oath, do no harm, right? Clearly the statistics are saying the opposite. So it's not just about teaching medical students or physicians how to care for different, cultures, but also to be empathetic, to care, right? If I look at you and I don't see me in you, I don't care. If I look at you and I don't see a human being, I don't care, right? So I feel like taking it a step further is making sure that we're able to provide empathetic care. Now, the second thing I want to say, sometimes I feel like doctors get a bad rap. I'm not going to lie, okay? So when we are laboring patients, it's a team. A lot of times the nurses are my eyes and hands, because I can't sit in the hospital and labor you all day when I have to be in the clinic or I'm downstairs doing a hysterectomy, right? So I have to be able to trust my care team. So that same standard that you expect for physicians, we should also expect of nurses, right? So you've seen some of these viral trends, and I wonder what that physician was thinking when the nurse was doing that. So that same conversation and expectation of empathetic and excellent care for physicians should be applied across all care teams, for doulas, for nurses, for everybody. We're treating another human being in a vulnerable state. Does that make sense? So, and the third thing that I want to say, and it's actually, I've thought a lot about this month, because it kind of made me sad. April is Black Maternal Health Week. It's trendy. People are talking about it. But my concern is the pipeline of physicians, right? So I have a lot, ma'am, I was busy, okay? And a lot of patients will come and see me purely because of the color of my skin. I get it, I understand. But what happens when we don't have enough physicians who look like you, right, in that pipeline? Or where people like me in, maybe, I don't know, I'm not saying 2 years, but maybe in 10 or whatever years retire, right? Right, so it's a multifactorial solution to that concern. You gotta make sure you have a standard of excellence of care, competent and compassionate care for physicians, nurses, and doula. Think about the pipeline as well. Sorry, that was a long-winded answer.
Yeah, no, and I'll add just a little bit to that. When we talk about lived experiences in pregnancy, healthcare is not a one-size-fits-all. From a cultural perspective, from a racial perspective, ethnicity, there are times where, as a care team, you experience that secondhand trauma. My team has experienced it a little bit, where you hear the stories, you see it for yourselves, you're walking through the doors, and these are their lived experiences. When we talk about empathy, I personally don't think that empathy can be taught. It either lives in with you or not, and through your experiences, your life, your stories, your family. Everyone grows up totally different in their household and their spaces and how they grow, the schools that they go to, their lived environment. So when we talk about social determinants of health, it all looks different for everybody. And so it's important that we acknowledge that, and thank you so much. I want to acknowledge that everything that you said, we are in those spaces trying to work through that. So thank you for that. So I just wanted to add that, and Dana wants to add something.
So a part of the reason that I actually started my doula business, because I do work in the hospital as a labor and delivery nurse. And while there, it is a collaborative with the doctors, correct? And you do have great doctors, but while you're there as a nurse, sometimes, exactly to what you say, these doctors are busy. They're busy. And sometimes it seems as though things may be rushed. Sometimes it seems as though things may be missed. So I can understand what you're saying. And we do work with the doctors, and we do try to let them know and collaborate with them. But this goes back to having that extra support, because like you said, empathy cannot be taught. Sometimes they're in a rush because they do have a lot of patients. And so having someone else there, like they said, the eyes and ears of the doctor, the doula and different things like that can make a difference. And to other point, as a doula, we are a little bit more holistic, same as the midwives and different things like that, and it is a continuation of care.
All right, nice to meet you, ladies. My name is Josh Berta Erich. I want to first start off by saying to you, Doctor, I will be the first volunteer to help you with your march, so let's connect.
We will not be televised.
Just to kind of shift the conversation a little bit, I just wrote down what I had. So I said, we as Black women are often advocating for everyone and constantly wearing so many hats. How can men be advocates in these spaces, and what can we use to encourage them to be a part of these conversations, because we deserve to have our protection reciprocated?
Yes, 500% talked about it earlier, but yes, you can download the Pregnant in Black app. There is that profile for the care companion, and then we are holding more events where we are having these trainings on how to really build that advocacy model. How can you be the advocate for the person in your life? And we all know that this isn't just a pregnancy problem. It's a completely care problem in so many different fields, but it's so stark during pregnancy when oftentimes our voices might be silenced because of the pain that we're in during the various states of our pregnancy. But I'm a big fan of, bring them to the march, have them download the app, and make sure they're getting educated.
Yes. And something I want to add to that is first acknowledge them in the room, in the spaces that they're in. Pregnancy is a lot for the care companion, for the mom. And so when we start to acknowledge fathers and include them in the care plan, include them in the conversations, they start to become a little bit more vulnerable with us. They start to share ideas, they start to share their thoughts, their mental health. And they show up in those spaces, I guess, like more supportive when they are acknowledged, because too often get in the room and it's all about mom and baby, but what about the care companion? What about the father? What about, the partner? And so I want to make sure that we are acknowledging them in the room in those spaces.
Delegate to the men. Give them tasks, give them things to do. Massage my feet, rub my back when I'm having my contractions, do this, hold my hands. Just don't, let them be a part of it. They don't just have to sit on the sidelines. They're your team. After the baby, set up, your shift is at 2 a.m., my shift is at this time. Give them other things to do. We don't have to always be so strong and do everything. They're a part of it. It's a partnership.
I think a lot of times the healthcare workers as a whole get a bad rap, and we forget that there's a legislation behind the things that sometimes the healthcare workers, your hands are tied with only so much you can do, and we have to hold our representatives more accountable. And that's just all I have to say, because we blame the doctors, we blame the nurses, we blame everybody in between, but until we have legislators, our representatives who are willing to advocate more, listen to the constituents, then this will, in my opinion, this will continue to be a problem. I'd like to thank the healthcare workers for all they do, because I know it's not easy. It's not easy. Doctors' hands are tied with insurance companies telling them you only have 15 minutes to see a patient and you have to rush out the room. That's the side that nobody knows, until you You have the nurses who, you probably got 50 million patients and only 1 or 2 nurses. It's not a question, it's just a comment I'm making. So I understand that your hands are tied on various issues, so it's not always your fault. So that's all I wanted to say.
My name is Maddie Mason, and I'm a public health nurse. And so I was appointed to the Perinatal Advisory Council for the state of Texas. And one of the recommendations from the Perinatal Advisory Council was you need to educate the Black community on the problem. Because if you see here, we're in the Black community, this room should be packed. And that was what, and so when they said that on the committee, and it was only 2 African Americans on that committee of 20 or 30 of us, I was offended. It's like, educate us. So I went into one of the communities as a public health nurse that I work with. I went to 4 churches. I talked to the ministers. I talked to the to the members, and guess what? They didn't know. Our community, the Black community, don't know the statistics of what's going on. And so that's where we have to start, is making us aware. And it starts, Black community starts in the church. You know, where we did most of our education growing up was in the church, but awareness and education is one of the main things that our Black community need to know. The other thing is Black babies. So we've started an initiative on saving our Black babies. 50% of Black babies die here in Harris County. But how many people say that? And how many people know that? And so that's my thing, is education and awareness.
Dr. Brown?
I wanted to follow up on this conversation around healthcare, and I appreciate you bringing up the broader picture, because a lot of what we're experiencing really is a symptom of a broader issue. So part of the reason that we have such high maternal mortality in our Black women is because pre-pregnancy, we have a lot of chronic disease that is not addressed. So the maternal mortality issue it has nothing to do with those who are underserved, those who are vulnerable populations. It spans across all social and financial backgrounds within the Black community. And unfortunately, we as a Black community do not take as good of care of ourselves, because maybe we're taking care of everybody else. Maybe it's an access issue. Maybe it's an education issue. But we have a lot of pre-pregnancy diagnoses which make us higher risk. Now, that's not the full answer as to what's happening, why it's happening. There certainly is a systemic racism issue. Gynecology was founded by a white man, so that experimented on Black women, okay? And so it takes generations to undo some of that. But I do want to address that this is a broader issue, not just for maternal health, but for healthcare in general. As a family medicine provider, I actually left primary care specifically for that reason, because I felt like I was on a hamster wheel. And as patients, you would never know it. And I truly hope that my patients didn't feel it. But my salary, my base salary, was based on how many patients I saw in a day. Every year around flu season, I got a panel of patients that I had never seen nor heard of in my life. And I was held accountable to make sure that they got a flu shot, because that's preventive medicine. And we didn't have, and we still don't have, a care team to address your needs. Let's say you do have a mental health concern. I don't have anybody to refer you to. They're either all booked, they're not in your network, and they have a quota as well. Let's say you have financial instability or you have a housing instability issue. I don't have a social work team to address that, other than to say, here's a piece of paper, go get on a list and sign up for this and hope for the best. And so this is more of a broader issue that we do need to address and pay attention to what is happening in our healthcare system. And the fact that we are a marginalized population only highlights it, that this is a broader issue. And healthcare should be at the top of your platform when you think about who you're going to vote for, what are the things that you're looking for in the candidates. Because again, this is a much broader issue than just the physicians, the nursing staff, and everybody else. There are some, right, it's the 80-20 rule. There are some that absolutely should not be practicing. I wouldn't want them practicing on my dog. I get it. But for the most part, people in general, providers, nursing staff, they are trying to do the best they can with the panel, with the volume, with the load that they have, and under-resourced to give you the care that you need.
My name is Titi Otunla. I'm a certified nurse midwife. I work here in Houston. And I want to agree with a lot of what you said. It's up to us to know about our health conditions. Talk to your daughters, talk to your grandmothers, talk to your mothers. You know, I see so many women who come in for their first OB appointment and they have no idea what kind of pregnancy their mothers had. They don't know that they have high blood pressure, that they had diabetes, that they needed a C-section for whatever reason. So I think it's upon ourselves to share our histories with our families. You know, aunties, grandmothers, talk to your daughters, your nieces, and tell them about, you know, what kind of conditions run in the family. You know, there's only so much healthcare providers can do. There's only so much legislation can do, but it's up to us to save ourselves. We have to do it. I work in a healthcare system. I work in a hospital. There are so many babies. I work at the Women's Hospital. They have like 11,000 babies a year. You know, there's only so much that the health system can do. It's up to us to share with our families. You know, I see so many women having baby showers, gender reveals. They come in, you know, do they know anything about diet? Do they know anything about exercise? Do they know anything about, you know, your blood pressure? So that's all I've got to say, is that we need to take care of ourselves. We need to take care of our sisters, our grandchildren, our nieces and nephews too.
Before you ask your question, we are going to start wrapping it up. So I know that there's a few people in the queue that we agreed to answer. Well, let you guys ask questions. You can go first. 2, 3, 4. Can y'all wrap it up? Like, make them real quick though, because my team looking at me sideways right now. So.
I agree with the comments about a lot of the medical issues or health issues for Black women could be mitigated with breastfeeding. Women who breastfeed have lower risk of a lot of cancers, and when babies are breastfed, they're healthier. What do y'all do to encourage breastfeeding, and what do you think is the best way to encourage breastfeeding?
Can you hear me? So hospitals are breastfeeding friendly. So a lot of that stems from having a conversation while you're pregnant, discussing that with your provider. And then even when you do deliver, making sure you make that desire known. I do believe for the most part, I will say that Texas does try to promote breastfeeding for women, but the key is not just that, but are you going to stay the course? It's not an easy thing to do at all. Okay.
As someone who just pumped exclusively for a year, I think that there are so many things that need to be in place for a woman to be able to do that. It is truly a luxury. How are you having the space to even return back to work? Is there a place for you to pump? You know, some women have to go back to work 2 weeks after they're giving birth. How are you supposed to breastfeed your baby? There are so many conditions that need to be met in order for that to happen, and I was in a very fortunate place where I could do that, but if anything had been different, there is no way that I could have done what I did. I mean, I had 5 or 6 sets of pumps. People gave me pumps. I was buying pumps through my insurance. I pumped on planes, trains, automobiles, in the office. They were always out. I was always pumping. But again, that was a luxury, and I don't know if every woman has that. And so I think that, yes, that is the gold standard and would be ideal, but are we promoting the realities of what it would take for that to happen?
One thing that I've learned also, so on our care team, we actually have a IBCLC that does home visits. And one key fact that I learned was breastfeeding starts way before the baby comes. The preparation, the education, and just knowing the different breastfeeding techniques, all the pumps, even to the point where I had to learn about certain things. I was like, I never knew this existed. So if I'm learning it, just as an SME, I know that there are a lot of women that have so many questions, but they're so tied up with so many other things. And so introducing it very early, for instance, our lactation consultant on our team goes out when the mom is 5-6 months, and she can have those conversations prior to, but at 5-6 months, let's talk about pumping. Let's talk about, it may not work the first time. Let's talk about the pump that you have that you got through your insurance isn't working for you. It's not a one size fit all. It's so much that goes into breastfeeding. And so I think education, encouragement, and support goes a long way. And for us, we do that in the home, at the bedside. And that's the beauty of having a program and being afforded the opportunity to have that lactation consultant. So just, of course, awareness, education, and support.
Hi, good evening. My name is Laverne Reed, and I'm so thankful to all of you who are sitting here and that you've called this together. And I'm with Milk Maternity. We're an organization that educates the community. We educate women on their health, nutrition, diet, exercise, sleep, relationships. And I'm here with my colleagues, and I'm listening to you all, and we're whispering and we're saying that we are trying to correct a broken system, and we've been, Black people, we have been an underclass in this country for hundreds of years, and the system itself is not going to change. So we need to prioritize building something for ourselves that's gonna work for us. And I know that we talked about $7 million coming to the city of Houston, serving 300 to 500 families over 5 years, and that's wonderful for those 500 families. But we're talking about a medical system that is not equipped for our problem. So maybe some of that money can go to train midwives. And it might take a couple years, but 2 years ago, if we had started, we'd have more than 8 Black midwives in the city. So maybe we need 20 Black midwives in the city, and maybe some of that money should go to training midwives to support. We need money to feed the women. We need money for transportation. We need money for education and community education at churches. These are things that we are doing in a small group, but the city can do it on a larger scale. And if we all work together, your app, your practice, my business, your business, your business, your business, and we bring it together with a specific initiative, then change can actually happen. But we have to actually see what can we build for ourselves, because the system is not going to change. Racism is not going anywhere. It's getting worse. It's getting worse. And so we have to think outside of the box and create our own platforms that don't cost so much money. It doesn't cost millions of dollars for me to take an hour to tell you something about your health. And if I have 50 people in the room, I can, one-to-many care is a lot more cost-effective. Thank you.
So thank you for your insight.
Hello, my name is Cassandra, and unfortunately for me, I was a statistic. So I had my son at 35 weeks here in Harris County. He was a stillborn. I found out about the condition of him very late, and I really didn't get the advocacy that I dreamed of, unfortunately, as a Black woman. And I remember sitting there like, this is it, this is my time. And really coming to terms with, I'm gonna die. I went into the hospital perfectly healthy. I got COVID in the hospital somehow. I had preeclampsia and eclampsia. And I remember in the midst of that storm looking at the machine and I saw my systolic was a 94. And I was like, oh my God, this is it. You know, and I have other children. And I said, you know, Lord, if I get out of this, I'm gonna make a difference. I remember telling myself that. So God bless him, God rest his soul, Luca Anthony. But I went on to get my CHW license, and I work at a hospital here in Harris County at a resource center. And one of my questions is, what would it take to have more accessible resources, like doula services being more accessible, being more affordable? What would it take to have doulas in the doctor's offices, OBGYN's offices, just like they do with lactation consultants? What would it take to have the resources there steadily, readily available for Black women who may encounter, unfortunately, some of these circumstances and experiences, so that they don't have to venture out too far for advocacy because it's right there wherever they get their care?
I'll start. Policy and funding. It starts there. If we don't have the funding to do the work that we want to do, we simply can't do it. And then from a policy perspective, if policies are not in place, we simply can't do the work. We're limited to what we can do. We had a big win about 3 years ago when Medicaid was extended to 1 year postpartum. That was a big win for Harris County, for all of Texas, where women can access those resources. Just recently, I believe it was United Healthcare, they're now funding doulas under their health insurance plan. So it takes change amongst so many layers in order to do the things that we want to do in an equitable way. Because when we talk about funding, we have to make sure that even our staff can live off of the pay that they're receiving for doing the work that they're doing. And that's so important. So I'll just leave my answer at policy and funding.
First, thank you for sharing, and thank you for doing the work to try to make a change. Also, with what you said, I do think it goes back to policy and funding. I do know March of Dimes is starting to partner with Memorial Hermann to try to allow doulas, assign doulas to different patients. I'm also trying to do some groundwork and figure out how I can help as well and to get into these hospital settings, because I do think that it's important.
And the Pregnant and Black app is free to everyone, no insurance required. And so that's one of the reasons that as a 501c3, we have been applying for grants and funding, and so important to be able to provide that free resource.
I used to work at Memorial Hermann, and I know there is a doula program, but I do believe the pregnant women may not be aware, right? So when I had patients in my office, I was like, oh yeah, sign up for the doula program. What are you talking about? Then I'll talk to staff, what are you talking about? So I think really put awareness about the services existing for doulas. Yeah.
Yes, and that goes back to even acknowledging you as a CHW. CHWs are essential to our communities. They're doing the groundwork, they're in the homes, they're in the communities, they're boots on the ground. And I think that that's such an essential part, where now it's getting more talked about with CHWs, especially I think March of Dimes released perinatal CHWs that focus specifically on pregnancy postpartum. And so it's important that we share a space, a like-minded space, and we're all doing our part. And thank you for getting your CHW license.
So I don't have a question. My name is Roa Hernandez-Caston. I am a doula, a mentor, a CHW, and a mother of 2 crazy girls, much like me. I have 4 comments. One, just so you know, the data is on average 4 years behind. So that 80% number is probably from 2023. When I got my doula certification, it was 2023, and at the time it was 60%, so that was 2019. To holding your staff and everybody accountable, we're allowed to Karen too. We can be Karens. It's not just our white counterparts. 3, Notice who you're seeing doing the work and who's showing up in and for the community truly, because just because a Black community healthcare worker says they're for the community doesn't mean they're for the community. And I know that to be true personally in Houston. And the movement is taking control of our births, our birthing locations, and our lifestyle choices. And my business is Roots Rise HTX.
Well, thank you all for coming out tonight. I want to first thank the panel for the amazing conversation, for answering our crowd's questions, and having such an honest, informative, and necessary conversation. Lariana, Dana, Dr. Ohuba, and Raina, thank you for your time, your expertise, and your truth. We appreciate you. And a special thank you to each and all of you for showing up, for being present, and for being a part of this space tonight. I also want to recognize Dean Calvin Johnson of the TSU, Barbara Jordan, and Mickey Leland School of Public Affairs, who's in the room tonight. And a final thank you to our resource and tabling partners for the work that you do and for being here to connect our community with meaningful resources. As we close tonight, I want to emphasize that tonight is not the end of the conversation. It's a continuation. Improving Black maternal health in Harris County will take all of us, not just in moments like this, but in what we choose to do after we leave this room. Each month, we host a Last Tuesday civic program similar to this, and the topic varies from month to month. So we do hope that you guys will join us again soon, and thank you for being here. Have a wonderful evening.